Hello and welcome to today's talk through Kundi Institute. I'm Dr. Robin Sodders, and I'm just going to take a brief second to introduce myself. Oops. I'm going to ask Yanzum to go ahead and just put me on. Thank you guys very much for joining us today. It's been a whirlwind to put this together. Hopefully in the future we'll be all meeting under different circumstances, but today we are going to be discussing the COVID virus that's been on so many people's minds. To start with, thank you for Kundi Institute for putting this together. And I'd like to also thank our partners. Our first partner that I'm going to introduce is the American Tibetan Medical Association, and the director is Anasira Weil. I'm going to ask her to take a minute and just talk to us who is the American Tibetan Medical Association and fill us in on her group.
Hi, thank you, Robin. So the American Tibetan Medical Association is a nonprofit organization that was started about 12 or 15 years ago in 2007. And we're exclusively dedicated to promoting and preserving Tibetan medicine in North America. So we want to preserve the knowledge and the practice and the ethics for the benefit and well-being of all beings. So we're really happy to be able to be a sponsor for this webinar today, because as many of you may know, Tibetan medicine is all about balancing not only the energies in our own body through diet and behavior and medicine, etc., but it's also about balancing in the external world, in our environment, with our communities and with nature. And this COVID-19 seems to be very much a product of imbalance. So it seems very timely that people are here to talk about this in terms of Tibetan medicine. And we're really happy to be able to be a sponsor for this and to let people know about the American Tibetan Medical Association. Our website went live yesterday, our new website. So I encourage everyone to go to it and to join and become a member and support Tibetan medicine in the United States and North America. So the website is americantibetanmedicalassociation.org. And thank you. I'd like to thank everyone for participating today. Thank you.
Thank you, Dr. Weil. Next, I want to introduce our second partner in this, which is Global Health Research Foundation. And we're fortunate to have the director and founder, Dr. Erica Wyrick here. She is also a family medicine doctor, and she's going to give a brief overview of what her experiences are with the COVID-19 virus. Doctor?
Hi, I'm so excited to be able to learn from everyone today. So Global Health Research Foundation is a nonprofit that I founded, and we work mostly on helping to provide simple, sustainable technologies to people in low resource areas to be utilized in culturally appropriate and locally controlled health improvement projects. So one example is a child nutrition application on cell phones that was designed by, and we helped to provide the technology and implementation, and then is being managed by nutrition health workers in Guatemala. So that's the kind of thing that the nonprofit works on, and actually how I met Kundi Institute. And then I'm also on the faculty at Stanford in family medicine, and I'm a clinician at Palo Alto Medical Foundation. So I guess today the most interesting thing I'm dealing with is taking care of patients directly, both clinic patients who are not sick but are worried about illness, regular patients, and then also managing patients who are concerned that they might have COVID-19, and then what's happening when those patients are getting sicker and are needing to come into the hospital. So we have drive-through clinics here at Palo Alto Medical. So we're actually right now not having people come right into the clinic in the way they usually do, like walking in to clinic. We're meeting them in the parking lot. And if they are sick, we're putting them through protocols that keep everyone safe. So they're going through testing, mostly getting their tests right in the car. If they're sicker than that, we can bring out portable x-rays and bring them into safe rooms. If they're becoming more ill, and we're seeing, you know, people looking okay for about a week, and then most people will start to recover, but some people are getting sicker, and about 20% of people who are needing to come into the hospital are getting sick enough that they're having to go to the ICU, and then none of their family members are able to be with them, and so we're taking care of them then in the ICU, and utilizing some medications that we have that are not really studied and are not really FDA approved, but that we're hoping might be useful. So it's I think very important for us to learn about, you know, what all is out there that helps us to be resilient and helps us to help our patients be resilient and manage the emotional trauma of this kind of change, and also help everybody get through this. So any questions about like what it's like for a patient to get sick, come in, try to see us, try to see their doctor, try to get a test, what it's like when people have to come into the hospital, and what it's like for the clinicians, any of those questions that I can kind of help with from the Western side or reflect on what we're seeing, I'm happy to do.
Thank you, Dr. Wyrick. Before I get started, before we start the main body of our program, thank you both American Tibetan Medical Association and Global Health Research Foundation for all your continued support with the Kundi Institute programs we do. I want to remind our viewers that if you have questions, there is a form that should have been sent to you. Please feel free to fill it out. At the end, I will hopefully try to find some groups of questions and ask some of the bigger questions, bigger group questions. From there, I'll be sending each of the doctors their set of questions to answer, and hope to be able to put together a spreadsheet, a document on all the answers for everyone. So feel free to write your questions in. That way you can still have them answered without interrupting the flow. Next up, we are going to start with Dr. Tawny Tidwell. She will be doing a brief introduction on the Western medical perspective on COVID. Let me read Dr. Tidwell's bio. Dr. Tawny Tidwell is a biocultural anthropologist. She has her PhD from Emory University and a Tibetan medical doctor. She completed her Tibetan medical education in Mentsekhang in North India and Surigling Tibetan Medical College in Eastern Tibet. Her doctoral work combined insights from contemporary neuroscience, Buddhist epistemology, cognitive neuroscience, and biocultural anthropology to understand how Tibetan physicians learn to embody diagnostic practices, particularly for cancer and metabolic disorders. I'm going to turn it over to Dr. Tidwell, and she is going to talk to us about the biostats of this.
Thank you so much, Robin. It's really a pleasure to be with you all here today. I'm going to go ahead and share some slides with you. So we're going to transition over to a slide share format just so that we have some visuals. And part of what I'd like to do in this is to just create some touchstones of the Western medical perspective, so that as we're going through the Tibet medical perspectives, we have some grounding in a medical system that we're more familiar with, some of the biology and pathophysiology. And what I'd like to also contribute is some of the biocultural aspects. As a biocultural anthropologist, we really look at how the cultural and social impacts our biology, impacts our resilience or our susceptibility to disease. And so looking at how different countries, different populations, different cultures, and even different individuals, the resources they have within their grafts or within their communities to really create greater resilience in the face of this very challenging time. So on the biological side, we'll just kind of do a little introduction to some basics of the biology and the pathophysiology, how COVID-19 presents clinically, its clinical presentation and manifestation, some of the diagnostics, a little bit about the testing parameters, and I think that Dr. Wyrick can speak more specifically to what they're using on the fly right now. And then some of the current treatment approaches that are more experimental and are more on the horizon, and some of the prognostics. And then looking at what we're experiencing now socioculturally at this time. So in terms of, so coronavirus is, this novel coronavirus is known as SARS-CoV-2, and it's what causes the disease known as COVID-19. And coronaviruses are a family of viruses. They're RNA viruses, which are single strand or double strand RNAs that are similar to viruses like Ebola, like rabies, the common cold, influenza, hepatitis C, polio, and measles. So this is a very familiar set of viruses that we've all encountered and experienced. And so some of the most common ones are actually what we encounter through infections worldwide, and we've created the antibodies and the immune systems to take care of those. Some of those viruses that were in non-human reservoirs and animal reservoirs that gain the capacity then to transmit to humans, like MERS, like SARS, like COVID, are ones that we have not gained the immune systems to recognize and to fight in our bodies. And so that's really what we're looking at with COVID-19, is that we have immune immune innocent experience to this specific type of virus. So if you look at the actual virus, it has these spikes, these peplomeres on them that are like crown-like, and that's where it gets its name. And so they stick to a protein called ACE2. And ACE2 is actually on many, many cells throughout our bodies. It's actually distributed throughout many tissues. And one of the unique capacities of the SARS-CoV-2 is that it actually adheres and binds to the ACE2 receptor in ways that the classic SARS could not. And so this allows us to see why it's able to initiate and start an infection with more tenacity. Also, the spike activates when these two halves of that spike get separated. And so that bridge that connects those two halves in this particular SARS-CoV-2 virus is actually more easily cut by an enzyme in our body called furin. And this is made by many cells in our body. It's found crucially across many tissues. And this might also help us to understand why we see more varied diagnostics, why we see more varied symptoms across different individuals and populations. Pathophysiologically, it's a major inflammatory disease. And what's unique about this also is that it's an upper and lower respiratory infection. And so this is why sometimes we see people that don't have severe symptoms until it progresses over time. And so some of the main symptoms are the shortness of breath, this fever, this tightness in the body, and that can eventually lead to this acute respiratory distress, and then eventually to multiple organ failure. So what we see in terms of the damage is really this overactive, exacerbated immune response, this cytokine storm that causes damage to the lungs and to the alveoli. And so this alveoli damage and the hyaline membranes that then encounter the physical response to the overactivated immune system creates these fibrosis signatures that we see that actually threaten life. So the incubation can be anywhere to 2 to 14 days, and we're seeing a lot of variation in that as well. Some of the other symptoms that arise that are not extensive, but many have reported, are lethargy, muscle pain, headaches, dehydration, even some congestion and sputum production among some individuals. These could be co-infection aspects. Some of the gastric symptoms are diarrhea and nausea that can present even initially before any experience of fever or dyspnea. And then what many of the otolaryngologists are talking about is this sense of smell that gets lost or disturbed, and this disturbed sense of taste, which might be a nice and helpful early predictor for us to see before you have any lung symptoms of these changes. So beyond these signs and symptoms, we're also seeing some of the testing coming online that's really trying to catch people at an earlier and earlier state of infection. So Emory just launched an online clearance system to look at what is your risk factor. So you can go on c19check.com, and it helps people, if they have concern, to look at, are they in the mild category, medium, or severity, and directs them at what point to really reach out to medical teams. And this helps our medical teams on the front line, like Dr. Wyrick, so it doesn't overload the system. So it helps people to really understand at what point is it important to go in, and how much can they manage on their own. The nasopharyngeal swabs that we see is really coming back into the nasal passages. It's allowing contact of virus so that it's not contaminated by the oral regions. These can be used for the PCR tests. And then we also have some of the non-PCR results, and then our chest CT radiographies, and then detection of antibodies. So the x-rays are not as helpful on that early diagnostic stage, but the CT scan, some of the things that are being seen is some abnormalities in up to 85% of patients. And these are reports from our early data in China. I think we'll have some interesting updates to that we'll see coming from especially North America and Europe. But you can see bilateral lung involvement, this kind of ground glass opacity, a haziness that really looks at some of the infiltration into the lungs, a consolidation. And then eventually you'll see also some interlobular thickening and air trapping. Currently, part of the treatment is really, as Dr. Wyrick said, trying to see what can help the patient as much as possible. A lot of them are experimental. Some of the fever reduction and analgesics like acetaminophen have been used as fever reducers and pain. Ibuprofen has been controversial. Some of you have probably read this in the news about its ability to possibly boost the amount of ACE2 receptors that then allows the virus to then spread faster. That's not conclusive, but that's something that is being explored. Some of the antivirals, remdesivir, lopinavir, ritonavir, are antimalarials of chloroquine. Actually changing the acidity on the cell surface has been one area that it's been looked at in terms of its possible activities. Also perhaps activating the immune system, and similar with the steroids on that part, but also immunosuppressants. And then we see our more mechanical, helping the body sustain lung function through ventilators, ECMOs, allowing the body to then fight off the infection on its own. So in terms of vaccines coming up, Dr. Fauci had said in early March that we're looking at about a 1 to 1.5 year timeline. I think that's still something that we're looking at. Dr. Wyrick can update us on that as well. But really, these kind of novel forms require time, require development, and don't have easily accessible outcomes that we can see quite yet. But one of the exciting parts about this time is I think we're seeing a new era for collaboration in science, that we have trials occurring all over the world, where we have data sharing, open science, where various teams from Europe and China, Iran, and North America are pouring in their data, are looking at how to really unite this. So the WHO just launched their global mega trial with promising coronavirus treatments, or what they call promising. So there's different arms that are looking at remdesivir as an antiviral, chloroquine and hydroxychloroquine as the antimalarials, and then a combination of lopinavir and ritonavir, an HIV drug combo, along with interferon beta as an immune system messenger that debilitates the virus. And then right now, just 5 days ago, the FDA approved using convalescent plasma of COVID-19 survivors to help them treat high-risk individuals or severely sick individuals with the antibodies that have been developed by these recovered patients. Prognostically, it said that up to 70% could be infected or would get COVID-19. Many of these will be individuals that will have mild cases, and many might not even be counted. The WHO China Joint Missions report had talked about 2.4% cases under 18 years of age, and that's still this greater risk category is above 60 years, but I think we're going to also see a lot more nuance as we get some of that data coming in. For those that are hospitalized, up to 10 to 20% being admitted to the ICU, 3 to 10% requiring intubation, and 2 to 5% passing. So right now we're looking at a possibility of 100 to 200,000 US deaths predicted. So in this context, we also though see this kind of socio-cultural response and epidemic of fear that's overlaid these undercurrents, which have already been putting our societies and our communities at risk. That's epidemics of loneliness, of depression and anxiety, distraction, not able to really attend to our immediate lives, which creates and has deleterious effects to our mental health, and high stress. And that's compounded with confusion about information and mistrust of sources. And so this also disconnection from our livelihood, our purpose, and trust, some of those pillars of our well-being. So when we look at some of the cultures and populations that have developed these skills of well-being, they have various qualities of cultivating kind of a vivre de joie, of life, of vitality. And so one of the stories that just came out is this 102-year-old Italian woman who had spent 20 years hospitalized for COVID-19 and had also survived the 1918 Spanish influenza. And so looking at our centenarians, our different communities, about what is it about this present-centered, connected communities focused on reaching out, kindness, cultivating compassion among tight social bonds, and really moving into a way to revision that right now we have an opportunity to kind of look at what are the skills in our lives that we're developing in terms of our mental well-being, the skills that allow for healthy social communities, and how can we integrate those, and really looking at boosting our immune system through these aspects that we have now immune response research that looks at the relationship between our brain and our gut, healthy microbiomes and digestive systems that also feed into healthy emotional well-being. So I think we have a real opportunity here as well to look at all the different intersections that are playing into our experience of this time. So thank you so much.
Thank you, Tani. I'm going to have Tani, she switched her screen back on me. Next up, we are going to have Khenrab Gyamtso. He is going to, hold on, so let me get my cheat sheet. He is originally from Amdo, Tibet. Dr. Gyamtso completed his education and training from Mentsekhang Tibetan Medical and Astro Institute in Dharamsala, and he achieved the rank of Menrampa degree, which is the highest degree in Tibetan medicine. He is going to be discussing the Tibetan medical perspective on COVID-19, specifically in addition to epidemic infectious diseases. He'll go through the whole trajectory of how this virus looks and reacts within the realms of Tibetan medicine. He will be speaking Tibetan, which is a treat for all of us. And then after he gets done, Dr. Tidwell will come in with a translation. Or Tani, are you going to be translating while he's talking?
I think we'll do it simultaneously, unless that has an effect on the share screen. So we're all working through this and seeing if it shifts around. So let's just see how it goes.
Excellent. So I am going to turn it over to them.
And Yangdunla, can you unmute Ginkanapla?
Okay. 참아도 다시들래. 아니 데린딜라 고디 징인 중문에 다니 디 딩상 찹심베 네임디 간디데 칠라야 페페메이션 나라야 아니 네임디 당자베 니니츠 카리비메데 니 지금 모두 지치로 지스지니 아니 근데 그게 난게도 단티 송자 아니 단디 그 네임 그 강인제 아니 지당 베벤 맹그 난게니즈디 예티네 갑티디 칠라미 마부토나 치게디 모두리 진행되나야 지 펜토나 된데 요바이나 아니 대야 지 내주게 친구들이 삼치네니 근데 디주 아니 통동 치크나나라야 아니 데른 같이 쉐어디게디 인디 컴퓨터나 도디치스 두스체바이 다이나 karma 정한이시나 셰코디 베메존나 송시베니르 코디니 슈투야스케 요마리데 이나야 컨투투 친도디 오네 지제 금일라 베베맹나나 송시베메존크 니춘토 뒤중우주 쉐라니 비주 쉐디 도세인스
So first of all, I would like to just offer my greetings, my tashti delays, we say in Tibetan, to all of you, particularly at this time when the COVID-19 pandemic is so present in the world, affecting so many of our lives. And I was approached to offer some of what, from the Tibetan medical perspective, is really understood about epidemic infectious disease, particularly from the theoretical perspective, but also how we understand this at this time. And although we don't have much time to go into this in depth, what I would like to do is just offer a short, brief introduction to our understanding of these kinds of conditions, and even though it's quite a vast topic. And so just use about 15 minutes to introduce, and with a 15-minute translation. So thank you very much.
담보들라야 대성 찾은 비닐 the COVID-19 시기에 네임디 아니 베베메슈나 송샤베게 림네기 찬다와 지레베스 지네 아니 티베이나 네임디게니 인상 찾세다 날리나다 닌 드라미 치소라 균자다 디제디 참말로 주 삼로다인데 디르 제베나노야 아니 제가 소래가 저 시에 토요는 거면 제셔비 주시나나 송셔비게 니네게 아니 송법대다 아니 다는 신게 조금배만 종리게 송셔비게 늦은 범진게 슝군도다 니르면 골라 송당 대체 아니 디스상 자초게 규당 아니 조금배만 종리게 송티게디 시샤네 맹아한tum나 니름 좁지게 아니 리우 좁제치마 두시 송요 디제디긴 로다 따용데 아니 딘상 캡진비 네임디야 아니 니네 데이터 아니 찬다베게 니 니름 지레싱아 좀는지 슈샤나 지키여베죠 네단 딘데 지레샤스.
So in this context, we're really looking at, is it suitable, is it appropriate to identify this virus that causes COVID-19 as a type of what we call nyerim, or the classical category for a virulent infectious disease. And as early as in the 8th century of the great Tibetan physician Yuntung Gompo, who is one of the founders of the tradition, in what he composed of the canonical Tibetan medical text, the Gyu Shi, known as the Tibetan Medical Treatise, and also some of his other seminal works of the Vase of Ambrosia. So in this text, among these 1,002 illness categories enumerated, there is one that we can consider the epidemic infectious disease called Nyerim. So based on this analysis of the Rim chapters of the 4 chapters dedicated to just infectious disease and the 18 chapters dedicated to the virulent infectious disease known as Nyerim, we can investigate in terms of how much of this condition can really be identified in this context as well, and looking at the symptomology, the modes of entrance, diagnostics, as well as treatment possibilities.
아니 베베메쇼나 송베 아니 안예름시엔디 남지 용여 지리베스나 멘데와지 아니 주탄께 아니 틴델라 땡치니 아니 남티 깝깝소니 용구여와지 게세 나임 딜레바 임바이나 딜라 믹세케 기주메바 임바이나 잠링기 멤버 tumbe 시타와이나 시샤기 찍티베니 메바수트웨 틴데케 나자지 인스치네 베비멘소나 체탄게 니르무 콜라틴데 아니 송당요레스.
And so Nyerim is actually, it's not a very common thing that will happen. So it's not like our common infectious diseases. They actually require specific causes and conditions. They have a greater tenacity. They also have greater consequences that happen from their capacity as illnesses. And so even though they only occur very rarely, and because they also have no specific treatment, they have the capacity to kind of ruthlessly eliminate up to a quarter of living beings on Earth. Based on these modes of transition and their resultant fatalities.
근데 송자 당이 니름 기세티게니 모두디니 두디슈에til라 니름 세til라 비비멘션나라 유진 컨디치 송구요레 이게니 따도 가리용구요레 디게 나자기 모 남당 칸데 용구요레 아능신게니 딜라지 ngongota chitupki rimbati yedi kandasiyo betati ni dudu sending sham ni marbe ni ngudi chishuya tu sins
And so for this reason, we'll really go ahead and look at what are the causes and inciting conditions that bring about a Nyering condition, these virulent infectious diseases. What are some of the aspects of how it's actually understood, its symptomology? What are also its ways of transmission, ways of prevention that can protect and allow for resistance against its transmission, as well as some of its treatment. So in these next several slides, we'll just kind of move one by one through these various different areas.
단 중주기 니름 간데 신바이나야 티 중야기 아니 주진자오데 아주메 숑니 송샤베기 숑구 공바도 좀 따용도 유진들랑 아주 remba니 간네와 치니 따초그레스 당부데 남비따줍당 게베 겐주페비 디블라타 초그레스 니와데 남티게 뜬제다 세주게 뜬제 로바 언데데 직 예진 직 따네 네 네임세데 니캅 중구.
So within this context, we can then see the various causal factors and inciting conditions to be described through two different dimensions. One is resultant from poor behaviors or poor conduct that is contrary to what, say, a Buddhist philosophical view and realization of understanding of how to live in a way that is coincident or cognizant of the reality of our existence, the reality of the self and its understanding, and also able to live in a way that has the realization of compassion and ability to engage in the world in such a way that has this understanding of the interdependence. And the second is really the dietary and lifestyle behaviors that arise or lead to the development of these conditions. This is in coordination with time of day, the seasons, and really our habitual tendencies that make us susceptible to these in the way that we can care for our bodies, minds, and health in coordination with the appropriate health approaches.
근데 송자 네 담보 넘비따도 단계에 네 지그 아니 단계에 네 갱에 중당 그디 코텔라 메션나네 가르송요 나기텔라 아니 롱데 동동지텔라 아니 쭉샤이스 단딩아 쩌르데야라 뒤쪽은 단계 메디 잔딩이 카투마라 아니 데시마라 슈샤기스 아답.
So right now, what we've done is to look at the causal factors and inciting conditions, and have actually taken out some critical excerpts from the Tibetan Medical canon in the 4 medical treatises. And so we don't really have time to read through what it says in terms of the causes and inciting conditions, but I'll just explain in general what the meaning of the sections include.
마음바나스 아니 꺄와니케 타마두 시름벨립기 미티지티게 삼루당 쇼시야디 아니 담 뉴모 요왕기 더차시야당 뜨미고 왕기 아니 다 쩌방엠베 레망타 치추비 디긴 주비티라 테네 아니 딘데게 네임 중에 유진지 차기요레스 아니 니바티 아니 추켈랭게 요장 매장 게스 추켈랭게 임바이나 아니 추기 나운든 쪼데 랑당 신기 등에세네 대화뚝뚝기 탑델란 베주지야세디 아 추기 도단게다 나운든 쪼지티 차대고래 이나양 추바 주임바이네 추기 냠스 랭고야디 마치바제 낭쿠케 특수당 탑조당 아니 딘데게 아니 chevinna ani ditkhiyage inji kilin dinde kari mabu chewaina deg yan leng yamba sakun jewela yan dinde ke name dinde chungya genji chakiyores.
So in these two different excerpts, it talks about a time in the future that really is characterized by poor conduct, poor behavior, in which one does not live in such a way that is cognizant and applying the desire to eliminate the suffering of self and others, to really care for the activities and behaviors that would support the harmonious living and the elimination of suffering. And so you see then this proliferation of afflictive mental conditions, of greed and desire, of rage and hatred and anger, of confusion, and kind of a lack of understanding in the world that then leads to this greater proliferation of the suffering. And for those who are, say, practitioners of the Dharma, of Buddhism, and those who are not, this is it has a similar manifestation. So for those who are not, that really engaging in these behaviors that proliferates suffering across society. For those who are practitioners of the Dharma, that they do not put into practice a lot of these teachings, that there's quarrels, there's a lot of fighting, inner fighting, and strife caused among these communities that have vowed to uphold these kind of practices, behaviors, and a dedication to this ultimate aim and aspiration.
And ling and Bashada, Pewa de la Tene, Susu with Jab Ani, Lama Yidun Kunju Chijun Soma in Bayne, Georgia Tablani, Susula in it, Novatangaki, Dindeg Ninizura, Lariores, Dindeg gained in the Chechene, Tandag name Tanda Nit, Venice not Senecated one, User Galo, Jumbala Soke, and it named in the time and about in the Junguris, Sonores.
And because of these non-virtuous acts, part of the 10 non-virtues that then get proliferated at this time, that these actions actually wreak havoc and wreck a world into out of balance, that environmentally, also communally, in our societies, we see the conditions for these imbalances to occur that allows for epidemic infectious disease to arise, other conditions also, dysenteric conditions, pulmonary infections, ulcerative conditions, smallpox, other pustule forming diseases. These kind of conditions then have the capacity and context to rise because of behaviors and lifestyles and activities that allow for their manifestation.
Mertawa de Beziki Joashi, Didi, Dajin Son, Shintachis, Dinde Son Yore, the Cars course, the Hui, Nazo da Hui, Yakumajawa Jene, Hui, any Latene, any Namjil and Jorachi. The Regikinian named Hatsuyo exchange Chakores. The Nangshingi Nazo, Mi Namjing, Cholam Nalaya, Chakshik, Lishata Jewata, Yana, Hui Tamame, any Timbangamba, the Nedupchayo Sage. Ni nedan tinde chawa yana ani jungula numa imbala so dung neba ani rangji ke semina katu ne be kasore ani gobe wang ani hongru lang de ya aning sing ge rang ke sim be wang katu nan jikta ba nga ta ke ma ta ba ni tu jenta ni simma ke be nyangi ta dunge la so kan dinde mangbu chewa imba ina digi yang susu ge su khamti ani manyum ba cha chi ni ani Zubu Joe Chandi and Shingi named in the Kandachium and Susulila and then Jiglil Hauta, in the any Chakayores, and in the any Sungayores.
So in the second category, in terms of what we see of the lifestyle and dietary behaviors that contribute to the development of these conditions, from the Gyushi, we see it described that other causes also comprise changes in the seasons that are in excess, deficiency, adversity to the norm, exhaustion due to excess physical exertion, contagious transmission of illness, contact with toxins and poisons, extreme rage, fear, severe mental distress, excess attachment, greed, all includes consumptions of unsuitable or contaminated foods that cause infectious disease. And at the same time, where we have various compounded chemicals from extreme and substances that are made from, say, ill intent or seeking after things that we think will bring us happiness and well-being or fulfillment when they don't, and through these either unintentional acts or at times these ill-intended acts, then we see then the context for this imbalance to occur that also leaves the body itself susceptible then to infection, susceptible to greater infection by creating conditions in the environment, creating conditions in the community that raises the occurrence of this kind of a disease, but also makes our bodies and minds particularly susceptible to the infection from these diseases and falling into becoming a source of transmission for them.
단 나자 코란 직책이 돈이 쉐바이나 아니 매양 베베 미숑 나로라야 아니 네임 디타브 주두 아니 치기 빡빡라 데니 림베 아니 샤 데니 네짜다 리고 데니 돈을라 두시마 아니 주그레스 디 직당대양 제당아주 가서래 미당 나와 나 카당 아니 치수 소바당사 상라면체라 아니 작투 중화에네 주그레데 망치와시에 도데 아주 나부 라네 아니 나자디 아니 주크요레 딘데 송장 디 직사디 나자디 요스 즈마 니스 소소라 포와 양나 나자디 요살은 주주치와라 때네 아니 디게 나자디 칸 두아 룽캄당 아니 랑파당 니미그 스르당 딘데 아니 수소게 수고가 파투 중화에나 디타위 네임디게디 니 밀라 아니 포구요레스 딘데 아니 송샤스.
So in terms of the other description of the modes of infection for this disease, it talks about that initially that it actually enters into superficial layers. So this could be skin layers, they could be epithelial layers, and then they gradually move into deeper penetrating layers of the muscle tissue through circulating through the various vessels, the vital organs, the vessel organs, moving further and further into critical systems and areas of the body. And that the main orifices for entry are the eyes, the ears, the nose, the mouth, many of our body orifices that have highly fluid-filled spaces that are absorptive and come into the body, but particularly actually the nose as being a predominant area of entrance. And so it said that whether there's something contaminated with an infection, whether it's coming into aerosolized particles on air currents, that these aspects of the infection then we are susceptible to them through exposures, and so this can even be various aspects of sun rays and so forth. So being mindful of the modes of infection and transmission is really important to understanding how this contagious transmission is moved through sequentially.
다 나자디게 체주 니름게 체주다 따와이나 나자디 ngo딜랑 아주 년신당 체바 롱슴 가드네 네 나자디냐 ngo 차대와 직제 니진치게 두디갑소 아주 베베 따라 쳤음 그 답답지요 디군에 나장이 숨 가고요와 맨주지야라 지야기 뒤져양 메데비 람산네 베가 소초도야 나자기 쯔잠지네 미망보는 그제지네 담니지 샤통도야기 나자기 네득치바 하는 신기 니름 셴바다야 나자 셴다 만다와 그러나 믹스에기 제투메디 람산 미그 체소키야 근데 링엠바스핀 듀 라테네 수수탄데야 디타베 니네케 나비 둥에티니 수수토와니 민트야 딘데기다 니름텔 니네텔라가 저 메송네 딘데기다 자주딘데니 송기요레스.
So if we look at the characteristics of these virulent illnesses known as Nyen illnesses, or the Nyajim, that there's actually three different combining factors that come together. One is the Nyen influence, the virulence, the virus itself, and a particularly tenacious form of it. One is the feverish and the heat that increases in the body. And one is actually the wind influences, is this lung. So you can think of it in terms of the neuroendocrine system, how it impacts our body through these different modes, affecting both mind and body through the relationship between the mind and the winds. It's particularly difficult to diagnose, especially by traditional means such as observation, palpation, and inquiry, our pulse, our urine, our tongue, and other means of diagnostics. And because it moves so quickly, that actually, because we can't diagnose it in time, it already ripens and progresses, then it really has a capacity to endanger and take life. And due to this rapid transmission, then it can take many, many lives. And it says even up to a quarter of living beings for these kinds of tenacious, virulent kinds of infectious diseases. And although, so it doesn't have a specific treatment specific to its etiology, then it also makes it particularly able to take life and destroy one's well-being very rapidly. And then because it has this aspect that's connected to our past actions, connected to the karmic relationships to it, then it ripens and it manifests and progresses very quickly as well into the illness progression.
Tanyene dig Cindy Rangshin La mention the Candas course to data benyensing Ming Tila, Chiming Tila, Titi Otang, Parawata and the name in Dasoyore. And it did with Cindy Zib Chinese and it Tangbag and Guitawa, Kachiwa Dutawa, and then Jirang Talandawa, Chagana Libdu, Kame and it Dumbu, at the Indichi, any Zib Tanya at the name in Zunangiores. And it did a big Cindy Jetty. 아니 미기 폐와 기후 폐와 미기다 미라 통하면 되니 인데 생각은 신발라 롱쇼 토데버 수도지니 아니 칼롱라트니 가사카와 주데니 니 바랑캄네 니 미기 니 바비부가 단하 고니 밀라니 슈쿠요레스 인데 부티가랑 신다 개친도 되는 시작소요레스.
And then in terms of the nature of these virulent pathogens, we look at in the Tibet medical context of the sin. Sin in Tibet medicine is a word that is a term that connotates these microorganisms that live on surfaces of our body, within our body, and throughout the environment. So you can think of these as this massive microbiome in the Tibetan medical perspective, and that there's a specific kind of sin that are called dejiho or barbata that are particularly virulent and particularly malicious in their capacity to do harm. Their form and structure is lizard head shaped or like a gaping snake's mouth. They could have comet tail or centipede-like forms. The kinds that are in blood or circulate in blood tend to be round, appendage-less forms. They're imperceivable to the naked eye, to the common person's eye, and they are easily mobilized through air currents, particularized into gases and airstreams. And so they can also easily transmit in any direction and then enter into skin pores, nostrils, various bodily orifices as well.
Nirimtige ngongo de la ta bebe mention na garson course du ta sonwa che to ta shiu ke chimbu yin ti son yore de la ni chini son to ta ani ka so nang ni son to tinde ge jimba la len tinde yewa china tinde ani yores ta yena yang ta chini sonwa de la ta nga zu nama songju chi ge ni dong ha ki dulung do ta de kilen ta malen de ne dong lo wa chires nga zu de ni kilen ba shisha ga thone 아니 가스 고르스디 세타 나타 아니 곰기 니비토네 치니니 네임디 고탄 그림바티 송고요레스 아니 제기토네 름숭 그주부틴다 타야 디 아니 바가토네 아니 송코르틴데 아니 켈라타야 아니 단다 아니 다는 신기 아니 당인진 그 곰톱라테니 하틴데 아니 장진에 근데 곰진인 데기 탑시기 돈이 네임되니 방고야 탑시된데 요레스.
So in terms of prevention methods of these virulent infectious diseases, we break them down into two categories. One is the external protections that we can use, and one is the internal protections that we can use. And whether you are a follower of this kind of perspective in terms of the external protections we can use, particularly in Buddhism and Tibetan Buddhism, the aspects of the mantras that we can imbue substances with, the talismans, the amulets that are used and put under ritual processes that imbue it with certain aspects of protection, the various substances that we can take in terms of protective pills, and also that we can adorn and wear as protection pills. So these are all aspects of the external methods that we use, whether it be substances that are actually considered sacred and aromatic and able to protect from the external environment, things that are ritual objects or mantras that help us to focus our mind to visualize aspects that are protective, and actual things like Dharani or the mantras that allow us to remember these aspects of the Dharma, remember these aspects of virtuous conduct, and to be able to confer this external protection.
다는 신기 가소래 당 고톱들라야 rangning kotub tang nyebin kotub tindege ya chapri yongyo sare rangning kotub seadi namsha ti jint maung bana dinde nyeru mayung ya gi chedo ngi gongde sheba ning shinki gijin tembi kap mi gi linga isum go cholum tige dila ani sabsab chego de hajang ke chenbo imba dinde songyo res nyebin kotub dila ani naza yosagi duwa langpa ani 가소래 내기 치마 아니 다는 신게 나자 요사기 님이 그실 저 참말라야 아니 소소고 삽삽지 아니 마포가 제도 참말로 아니 삽삽지가 이렇게 전부 자기요레스 가요에서나 리그 나자디 리그 아니 바피부가다 강보가 내가다 어떤 딘데네 니 파란 주용구 있는데 이게 참말로 네버도 아니 삽삽지고레스 하버도 가소래 나구시엔디 내 탐진 직사겠다 고술도 어디 손상 대송고야 돼 하정 개천보니 송고요 어디 손상 인산 치제 롱발래야 가리가나 수수내바 이마마도 아까소래 젠네 나게 맹이 가리가 조금 해봐 된다 인진 직선도 대송에 나랑 그 삼주제와 있나 용수 놀고요 그랬삼도 가리도 나저 연애인데 맹인기네인데 네임들이 뭔고 어찌더니 가고야 돼 하정 개천보니 통고도
So when we look at the various measures that we can use, particularly behaviorally, but also in diet and cultivating resistance, we can divide them into two different kinds. One is distance methods, which also means distance temporally. So early methods that we can take that will prevent the conditions for infectious disease to ever arise, but also distance methods in terms of making sure that we are cultivating that resistance. And the other is close methods, more proximal methods of resistance. And so in terms of these more distant or these early on methods or distal ways of cultivating resistance, we can think of it also in terms of what was said earlier of our behavior of body, speech, and mind, of ways to cultivate our activities, cultivate our engagements with the world around us, with each other, with our own bodies and minds, in allowing for our to allow for the conditions to arise so that we're not even exposed to these kinds of infectious diseases, and also that we don't cultivate the context to be to fall ill within them. And then the more proximal methods of resistance, these are really looking at the portals into our body that allows for infection and transmission. And so this is what we were also talking about, our bodily pores, our the sensory organ portals, so to speak, as ways that infection can enter. But then again, we also look at the nose as being this major entry port to disease that we are vulnerable to. And so really caring for this as a gateway to protecting ourselves from infection, to allowing for our bodies to create resistance by just taking our behavioral methods into comportment is also very, very important in how we look at these preventative measures.
다는 식의 네임 따디 갑딜라야 아니 칼라야 부사고야 sem금 기부진이 아니 대고야 대 하장 개침부레스 저거 동바제 주부조자 sem금딜라 신앙당 암다 인데게 니디딜라 나잔디 네임디네 수술은 죽을레하 딘데 용구요와 딘데 메중나 송구요레스.
And also particularly is the importance of eating a good diet, and also having a mind that is optimistic, that is light, that has a really good outlook, is really critical for protecting from infection. So it says that we're particularly susceptible to infection if we're hungry, have an empty stomach, or when we have depression. So it's particularly important to protect against infection during this time. And that when we really do take care of our minds and bodies through good diets and healthy mental states and emotional patterns, and we create that resistance to the infection and the transmission.
다다는 신게 능가 카질라 때니 송톱딜라 칼라다 메니샤가 송톱된데 몽부 송구도 되다 이내에 차상 슈투야 민도스 다 개치슈딜라 메존나라 지카르 송샤스 나가주 참매락 렌체트베디 rim네켄라 뇽다 추고 땡 송요레 덴다게 녀름트딜라 아니 추차오 동고야데 하장 개체모임 바디 송고요레스.
So for the internal protection, there's many different methods in terms of diet and various medicines that we use, particularly for these kind of conditions. And we don't have time today to really go into all of the details of these aspects. But something that that everyone can really take up in terms of protection measure is really looking at fasting and hot water, and really taking in a lot of hot fluids into the body, and staying, and this is an important aspect for also preventing any infection, preventing the ability for infection to occur.
다 니름티게 딱 정당 따바이나 다 지다스에라우디 딘데 주송요레스 니름티스 부나 쉬운디 샤마 카시용군에니 심마키바 치바사야 컨트롤랑야 심심닝 문도 중야 니캅스 티치기 중야 딘데게 따용 그레스 나자데 믹스즈 부고 드네 강롱라 바네 디요 사이고마 니 숙스리 중야 딘데게 따용 그요스 디마세 아니치 나조르 지다데라 아니 로자야 두바자야 차완바야 미바당 추바도 니 가 인데게 참다된데 아니 대용 그요 딘데 송샤스.
When we look at the various diagnostic signs of these virulent infectious diseases, we can look at them in terms of just general symptoms that occur from all of this category of the Nerim. And so these are that in the first few days before even the full manifestation occurs, you see a greater irritability, susceptibility, anger, and rage. And that when one gets angry, one feels the tendency to start crying or start becoming emotional in these ways, that having a susceptibility to loose their bowels, to nausea, to vomiting, but particularly that our pre-existing illnesses, our pre-existing pains, conditions tend to aggravate. So having greater pains in certain areas of our body, or our existing conditions aggravating in their the severity of their symptoms. We also see coughing, sneezing, a sore throat, hoarseness, kind of a rawness to the nose and the mouth, fever, obstructed respiratory pathways, and even sometimes a runny nose.
아니 나자딜라 세조그 토닝아 투다디 나자디 수수주불라 포차바이나 아니 까르지 마르시 나르시 큐르 디제디 인지미지니 뽕고그레스 참발라 큐슈슈시 시와마 참발라 나잔딘데게 니름 포타지 큐르 동와이나 시야그라니 아니 가소레 코코마타나니 망아니 테키요르스 데줄딜라 네버드 사포트 송요레스.
And then particularly in terms of dietary heed that we need to think about when we're looking at virulent infectious diseases is really minimizing and abandoning, if at all possible, diets rich in what we call the whites, the dairy, the milk, the yogurt, the butters, reds such as meats, and then tastes that are sweets and sours. So a lot of this input will actually exacerbate the infection and make us much more susceptible to it.
소톱기 남장 그 차니 쉐바이나 아니 나자디 수푸나 레선니 밥사기 아니 카시 레팔라 밥그르 카시 로아 밥그르 카시 지마 밥그르 카시 포알라 밥그요 카시 샬라 밥그요 다지선 밥사가 왕기 아니 아카소레 아니 나자디 아니 민이요 만다와 만다 다치니 가서 니름 쪽예스 지니 두시 용기요레스 대주 소소라 밥에 소소소가 네타야 만다와 만다 된다 용기요레스.
And then in terms of the various different types, a Nerim can actually affect specific regions or organs in the body differently, and they also have different pathophysiologies, different etiologies, and based on these different characteristics, then we provide also different kinds of conditioned names. So you can look at, say, for the brain, you have viral encephalitis, for the throat, pharyngitis and laryngitis, the upper body, this upper respiratory inflammation. So based on where it primarily manifests and takes hold, and its specific pathophysiology of that specific Nerim, then we have various types of Nerim that we also look at.
당상 그 COVID-19 세 Nerim 디안 디낭니 로틀라 파페 아니 tözer 암양나 서통세 디당 하장 아니 찬다고 통고도스.
So when we look at COVID-19 and the virus that causes COVID-19, particularly it has a likeness quite similar to what we call the Rodut Dusert, which is the Nerim that's for the upper respiratory inflammation called Serdung or Dusert as well. And so you see this in this chart as well.
더 제탑 그 차니 쉐바이나 아니 디 가소레 bebe mention nang lo la rimkyang ta nyerim tinde ko la hajang jetuk the major ga nam tang mangbu shibu tu de ina ngi chasan di me de la ni nyerim chobje ki nang lo yode be major ta hak ta sonwa ta dinde ga jebu ta thang shi shuming ko ga nam tang jinga sinti do ding ye rob di na chu pa be wa dinde ga ta lagle ni mandawa tinde mangbu song shas.
And all of the various 18 different kinds of these infectious diseases have their own treatment protocols, their treatment approaches and methods, and depending on the progression of it, the severity of it, which types of treatment methods and which aspects of those to come online are quite different. We don't have time to go into all of these, but right here in this chart, we see that aspects of mantra, aspects of ritual, protection formulations, decoctions, pill formulations, powders, cleansing formulations, and external ointments. These various different types are used for these different kinds of conditions, all different for the various 18 types, and will be employed at different times.
Tari ni name de la ngarang ta chu china zertong am tezir da wuchi ga ta bai na ta de la tangbu ne name de chu di tangbu mai mamin be na ba ti ni shargi yores mamin be ne kom ne ni ya ni ngunchu ne ni thama de ni de loa gang la pap dinde chi na za ti ro ta de da wuchi cha de go tari name de ti su ro chi thong do mamin be ne kop de la ha ko go men do ba 나저도 주요메 강점실라 민라 마민 sabde ene 장심 자야 당 되게 되니 용어돼 그도 이 송자 아니 내염들라 나라랑기 베베맹 돈이 통당하고 가든 추구 약고 동고야 당분에 아니 가준라 탕글랑내요 탕디들이 값이 약고 동고야 하정 계신 보래 삼고도 딘데 통투바 임바이나 나자데 아니야 로아던 딘데나 아니 참마트바제 아니 하산이마 나자게 아니 구마야 혼님 투야다 딘데게 아니 자진의 요방이 통구도 예나야다 아주는 아파트인데라 믹스케민 아야다 딘데 고급고 용기와 말이스 이들라니 펜션의 메이저 가시의 민지니 지샤이스.
So when we look at COVID-19, it has a high resemblance to what we call zertung or doser. And so this is this classical category in the Tibetan medical canon of a severe upper respiratory viral infection. And so this also, what we're seeing often is the occurrence of what we call mamintsawa, which is an unripened fever. So often a lot of the early symptoms and signs that of mamintsawa, of the unripened fever, do not appear. It's just very mild symptoms. You see just a mild fever, you see mild impact to the upper and lower respiratory pathways. And so at this time, it's really important then to take in hot boiled water. And we have a particularly special category that's important at this time of the progression of the disease, and that's called decoctions or tongue. And so this helps to perspire and break the fever. It helps to really support lung function and help protect the digestion. And so what has been presented here is just some of my perspective on what these important decoctions would be at this point in at the mild stage of the progression of the disease, as well as some of the further ones down below. And so for now, we're just going to go ahead and close it up, and our time has come, but thank you so much, and thank you for listening in.
Thank you, doctors. That was really great. Hopefully everybody's learning a lot and being able to widen their perspective through this. Next up is Dr. Tenzin Namdal. Let me read his bio a little bit for you. Dr. Namdal's doctoral research is funded by the Wenner-Gren Foundation and the Fulbright Hayes Fellowship. He examines how death and dying perspectives of Tibetan medical doctors, Buddhist practitioners, and lay people translate into their care for dying individuals and informs their own attitudes about dying. This ethnographic study explores the Tibetan medicine contemplative practice called Tukdam and meditation, a meditation and adept practitioner engages in after clinical death. Dr. Namdal is going to be discussing something I think hasn't really been addressed much in these webinars, so I'm grateful we're having a chance to talk about it here. He will be discussing coping with existential fears and the public health perspective of COVID-19 through the lens of Tibetan medicine. I'm going to turn it over to you, Doctor.
Thank you. Thank you, Robin. So Tashdul and greetings to everyone here who is engaged with this conversation, as well as hundreds of people who are listening to us on Web Live. So this is great. And I mean, before I start my presentation, I quickly want to express that in time like this, it's really hard to find a silver lining. Everything is really so unpredictable and uncertain. But Tony mentioned it very aptly before, that one thing that has really it's happening is bringing doctors and scholars and researchers from different discipline background on a one common platform, and trying to see how best they all can work together as a collaborators. And so I think I really want to thank the organizing team here. We have the Global Health Research Foundation, American Tibetan Medical Association, as well as Kunde Institute for bringing us all together here. So this is really great because, again, me coming from the side of both the Tibetan medical physician as well as medical anthropologist, I'm really seeing an opportunity here to bring the biocultural component here, and we have to look at in the light of unprecedented uncertainty and relentless changes that's happening, that's impacting our normal life, how this global health crisis is impacting our the healthcare system and the community in general. And I want to shed light on that, focus on 3 key points. And these 3 key points are disruption in coordination and in community in general. The second point, I really want to focus on the deep sense of loss of personal agency. And finally, the third one, I want to focus on existential fear. And how I want to do that is, again, as I said before, I want to come from the perspective of Tibetan medicine, as well as some of the findings of my doctoral research. And so let me start with the first one. And in a sense, 3 of these themes or points that I just mentioned, they kind of lead to each other. And so it's kind of a direct pathway that leads from the first, when we have a disruption in coordination and its impact on general community, how it actually create that situation where almost everyone have this feeling of deep sense of loss of agency. And I want to really emphasize why that's happening. And then how that particular deep sense of loss of personal agency could very much lead to the sense of existential fear. And certainly in current situation, we are looking at how they can lead to a certain feelings of being very close to dying, or being exposed to an illness which might not have a care. So let me just start with the first point. Why I really want to focus on this particular point of disruption of coordination is the impact on community in general. Is, see, from the Tibetan medicine perspective, the things that which Tony and Khenrab laid very eloquently before is really about when we look at the etiology of a certain illness, like what we are dealing with here, the COVID-19 here, a pandemic, is really how we understand the source of such illness. And in Tibetan medicine, everything is so very much related with an individual's behavior, and more related with the moral behavior. And so in Tibetan medicine, there's a very strong common point of reference, the reference that leads to an individual contribution that one can make, both in terms of being susceptible to the illness or being resilient toward the illness. And so it really starts from individual to the communal level, to the national and to the global level. And I think that's one thing that we seem to be missing in current situation across the board, and particularly more so in a community where there's a lack of a common reference point. Now, having said that, we also need to understand that the current situation has really inundated the healthcare workers, the medical facilities, and why that is happening. So again, one of the things that we are not able to follow in a collective manner is how we can actually be adhering or making ourselves the full participatory collaborator in this in this project or in this enterprise. So I think it's so important for us, and especially in this current situation, to have that common point of reference. And I think again, the things will boil down to how an individual participation, individual ownership is so critical. Now, ironically, this can lead to the second point that I was mentioning earlier. It's about the deep sense of loss of personal agency. Now, it's really interesting in terms of how we can be individually very collaborative, yet at the same time, in a certain culture, like in a Tibetan medical culture, or Tibetan Buddhist culture, we don't necessarily focus too much on individual itself. The self-centered focus is very much discouraged. So how you can actually be more proactive in contributing individually yourself, yet not putting focus on your own self or ego. So that's the way I think in current situations, especially in the West, the problem that we are facing right now is why we have this deep sense of loss of personal agency. Now, we have two different situations here, as I mentioned earlier. One thing is we have the severe lack of coordination. Now, and then the other thing is we're constantly overwhelmed by all these different informations via media, via different people's opinions and view. They are not necessarily in the mainstream media, but they just will show up on social media. And what that could happen to a society or the members of a society where there's an inherent importance on individual self. So it almost seems like everything that I see myself as a personhood that has been taken away. You can't go out, you can't do what you do in your normal life, quote unquote. And so that thing really, it's hard for the community members, I feel, to reconcile with how the situation is unfolding every day. So that's why I think coming from the Tibetan medicine perspective, where the individual focus is very much discouraged, yet the individual contribution is so much encouraged. And so I think that's a way for a conventional society, I think it could be so confusing. That's why, as I said before, again, in the first point, it's really about how you can actually find that common point of reference. And in a situation like this, it's so easy and so we might feel so susceptible to get into that confusion. And now, again, I want to emphasize here that such kind of interpretation could be very abstract in nature, but these kind of a situation could very much lead to a strong sense of existential fear. And this current situation, the existential fear is very much related with COVID-19 or the pandemic that we are exposed to. And now, so I want to, the final point, which I made earlier about the existential fear, I want to break them down, even though it's a very general sense of being existentially having that sense of fear. But I want to say that when we are looking at the existential fear in current situation, we are looking at two very specific population. One thing, one population said it's the healthcare workers. They have been on forefront ever since this situation started to unfold. Doctors and nurses and other care providers, they have been right there, and they are the most vulnerable members of community at the moment. But then over the course of time, in the last few weeks so we have been overseeing one particular sections of our community, which is the older population. Now again, the older population is not just only the physical susceptibility, they are also mentally very susceptible. In Tibetan medicine, we usually say that the older we get, our lung energy or the lung nyeba would start to increase exponentially. Now, when we talk about lung is actually equivalent to our nervous system. So in a sense, we become way more reactive or responsive to external stimuli. And currently, one of the stimuli that is out there all the time is our fear toward COVID-19, or if we get that, what could happen or might die. And so that's why I think it's just so critical right now that when we're looking at the existential fear that's being generated by this particular crisis, is really about looking at both these two populations in our community. And having that understanding, I think it can also really lead us to a pathway where we can not only help these two different populations, but also can make the broader environment much more secure and suitable for general population. I want to underscore on this particular point how we can do that. Okay, of course, we have to respond ourselves to all the healthcare providers and researchers and epidemiologists of what they are saying. So the first thing is really, they all have been unanimously saying that we don't have the luxury to stay at home and physically distance ourselves. We have to be the hospital in the forefront because we need to care for patients or other vulnerable people. What they expect from general population is really to stay at home, not to socialize and not to get yourself out, putting other people in danger, particularly one of the subset of population, which is the elderly people. But then we are also making things way more difficult, inundating the healthcare workers, because the more we get exposed to and more we get infected and more we have to be admitted in the hospital, we are overwhelming the healthcare workers and resources. And so that's a very critical thing, how we can actually respond to this particular situation that's creating existential fear in these two subset of populations, and how we can respond to this situation. And now, two things that I want to lay out here, in addition to what I said before, which is really to complying with the very broad message that is being presented by the healthcare providers and researchers and epidemiologists. From Tibetan medicine point of view, one thing is really, we have a concept called Rangshin. So Rangshin can be translated as an individual's inherent or a constitutional nature, which is critical. As I mentioned earlier, people who are older and tend to have their lung or the nervous system super sensitive, and therefore they will react to every situation very sensitively, very instantaneously, and we need to understand that. But having said that, in our general population, people who are a little younger, people who are in 50s or 40s and younger than them, we can work on the same assessment, using the same assessment of ourselves. So we would have the link to how one can assist themselves, and how one can follow certain guidelines in order to not only make yourself more resilient to the current situation, but also how you can take care of yourself in terms of not only being responsible to yourself, but also to the larger community. And I think this is critical, because putting yourself in a situation where you can regain your personal agency, not for the sake of me having a chance to go out and do what I want to do, but regaining your personal agency to develop and cultivate more resilience. Now, the second point is based on my research finding, which is really how you can actually transform any kind of a challenging situation or vulnerable situation into resilience and a source of developing compassion. And I think I was really intrigued when I was doing my field work, where, as Robin mentioned earlier, my work was really on looking at how in Tibetan community, Tibetans care for terminal patients. And one of the things that I found over and over again was the way people are able to develop compassion for others and therefore generate resilience in the face of very difficult situation. How they do this, very much, and the tool that they apply is very much informed by Tibetan Buddhist culture. And so they basically, however difficult situation and stress that they are experiencing, they relate that to how other people might be feeling in that same situation. And in doing so, they're able to completely flip the situation. And so they develop a certain deep sense of care and concern for others who might be going through the same experience. And by doing so, you are basically shifting your whole interest or focus from yourself to others. And when you do that, you not only are able to make yourself feel almost secure and resilient, but it also make you much more proactive in engaging in that activity. So I think these are some of the things which I felt when I was kind of doing some research for this particular conversation could be really critical. And as Robin mentioned earlier, that this particular component or how a current global crisis could have impact on population in general, and then particularly on individual, and how that could translate into some of the very common emotions that we might be experiencing or displaying, which could be an existential fear for death or toward COVID-19. And I think these are some of the key points that we can certainly spend more time discussing about. And I will welcome any questions or any comments that any one of you would like to have. So I'll conclude with these few points. Thank you, everyone.
Thank you, Doctor. Sorry, that was great. That was actually really interesting. Next up, we are going to have Gyamtso Khalsen. He is going to discuss Tibetan astrology perspectives of the COVID-19 virus and how that relates to Tibetan medicine. Let me read a little bit of his bio. So Dr. Khalsen graduated in 1989 with his Srimpa degree, which is an equivalent to a PhD from the Tibetan Medical and Astrological Institute in India. He completed a full course of study and 6 years of training in Tibetan studies with an emphasis on traditional Tibetan astronomy, astrology, medical astrology, and Buddhist philosophy. He's also been on the staff of the Tibetan Medical and Astrological Institute and was one of their senior lecturers. So I'm going to turn it over to you, Gyamtso, one of my favorite people to listen to.
So first, I would like to start with some prayers. So a little bit like a prayer as a salutation prayer. I always start work with that, and so I did really fast, so because I don't want to spend some time on this. So I'm going to look from 4 different perspectives on this COVID-19 situation. So when I did a little bit research, what a different astrologer generally in the world are predicting on this, and so I compare. I was more closer with Indian astrology, and Western I'm not too much familiar, but I have some ideas how it works, and I'm more related to like full-time jobs or like on Tibetan astrology. So I've been practicing the past over 30 years. So now what I look important thing is when that disease, when we knew the disease, like when the China, Wuhan, when they reported that disease to the WHO, and that date I considered very important. I wrote down that, and I'm going to speak. There are 2 important dates I pick up when they first we knew, and in the world, and the second is outbreak was declared a health emergency of international concern. And that's another date important. So one is the day, the real exact day I should get, I cannot find that because it was at the very beginning, it was very secretive from Chinese government or Chinese people over there. So when we knew that, first they reported, I mean like December 31st, 2019. So this is the day. So I just particularly done a little bit analyze what happened on that day, particularly how the elements are lining up. And so then December is when you numerologically, when you add up 1 + 2 is 3. 3 is the planet responsible is for Mars. Mars is related with the element is fire. Then 31st is 1 + 3 is numerologically 4, and then 4 refer and astronomically and astrologically in Tibetan system is Mercury. Mercury is a water element. And then we have 2019. When this I add up, I got as like again 12 + 1 again it went down to 3. So it's a Mars. So that very day, December, we have 2 fire element and 1 water element. Then, and according to Tibetan calendar, our calendar is based on lunar calendar. So we have a little bit different way, like as compared with the Jordan calendar. So that means the Western calendar. So that Tibetan month is 11. 11 means 1 + 1 is 2. That means moon, the planet moon, water element responsibility. Then the date is 5 in Tibetan calendar, which is planet responsible related is Jupiter. So we have no earth element, and space is the ether. It's like a universal element. It doesn't count. So out of these 4 elements, the 3 elements play a very important role when we discover. So, and then I look according to a Tibetan combination of constellation and star, what they are explaining. So I'm going to read 4 verses in Tibetan. The combination of the element is water and fire, fire and water. These 2 elements at that day, the responsibility. So when these elements join in conjunction together, what the interpretation according to Tibetan textbook, I'm reciting in Tibetan, and I'm going to roughly translate in English. Mechu teva chivejor chivejore soktoches. So bottom line is what they are saying is this is a combination which will have a lot of chaos and a lot of death, and so a lot of problems. Bottom line is very unpredictable problems. So that's the combination explained. Now I'm going to the second date, which I consider is very important, is outbreak was declared health emergency of international concern on January 30th and 2020. That is now the world started and the WHO started initiating more, and all over the world, people are a little bit get more aware, and all the countries, everybody is starting taking some measures and putting more into action. So how to eradicate this disaster, so-called COVID-19. And again, I analyze with that date. January is the first, number one. Number one is sun. The planet is sun. So it's a fire element. And 30th, 30, and 0 doesn't have effect. So 3 is a Mars. Then 2020 is 4, 2 + 2 is 4. So this is again Mercury. Mercury is water element. Now Tibetan calendar, we come back to Tibetan calendar, is a Tibetan month at that time is 12th month, is again 1 + 2 is 3. 3 is Mars. And then again the date is 5th. 5th is Jupiter, and responsible element is wind. Again, this element, there's no earth. Earth doesn't play at all role in both cases. But the shift is there, different is there in the January 30th, 2020, where we saw more fire element. And so the more fire element more actively. But the same still we have water and so on and so forth, but more fire elements. And that particular day, Tibetan combination of planet and constellations explains that fire and the wind combination. Now it's shipped, a little bit shipped as before. What happened is that time is the, before we have water, fire and water, now we have fire and wind. Wind in generally, normally, like let's say oxygen helps to burn the wood, for example. So it's sort of like now it's getting the ship we see is more positive. Even the interpretation according to Tibetan text, I'm going to read in Tibetan, and then I'm verbally going to translate Melung Teva, Tomden Jorwe, Tashiches. So now it's that energies and positive started coming because now people started putting their work and initiate, everybody's taking more responsibility and try to work in order to eradicate this disaster. So now a lot of positive signs, we are seeing the sort of like end of the tunnel, we are seeing the light there. So now these are the two important day I analyzed with how the element, why I did that is in whether you talk about Tibetan medicine, Tibetan Buddha Dharma, element is key role. Like we talk about external and internal element, then alternative or separate element. So I don't want to go on all in detail. It's not so much a time right now. So the element, how it disturbed, and now we have so a lot of fire is there, you know. So that fire means the fire is something to do with, and I consider it's a remedy from point of view. The fire, like as Indian, there's always saying called like metal with cut metal, you know. So like poison is antidote for poison, and so fire is an antidote for fire. So there's like alchemic type of science theory behind that. So like that's why the previous doctor explaining have to do a lot of, you know, hot water, and there's something to do with the heat. We also already saw the planet, how it's lining, elementally, how it's lining up. So the heat. So that's why a lot of hot water, as mentioned by Dr. Khenrab, and so all other previous doctor also explained. So now the heat. So the India, now I'm going to still a little bit about remedies. So what the Tibetan, you know, astrologically we can, as a remedy is that like there's in Tibetan Medical and Astro Institute. I was just back 10, 12 days ago from India. So that time in India, I was in North part, it's not so active, even there's no cases at all. So I was teaching there to the younger astrologer and staff there about, and then they had asked me, and why, you know, the one student said, why the amulet? They made two different colors of amulet. One is blue and one is red. The blue is for the women, and the red is for men. There's always in a Tibetan medical science, and they're always the energy of the man and women always different. How it's, you know, like even say light energy, how it transfers man and women is different. When they read pearls for men and women, it's different. So they just to distinguish, so they make a two different color of amulet. And I'm not going to go in detail why it is, but they just to, you know, men have to wear red, women have to, you know, wear blue. So then what is inside that as a remedy? We put whole the mantras inside, and they are holy seed blessed by Tibetan State Oracle, Dalai Lama blessed seed, so the higher Lama's blessed seed. So it's connecting with a higher power than when we have disaster. Sometimes we cannot do by ourselves. So we have to depend to someone who is more power and having more energetic and more energy or more helpful than us. So there's a normal nature of a human being. When we cannot do, we have to depend to somebody. So as now the amulet, exactly what this is, the mantras are in a positive, and then they're wrapped up with the 5 different colors. I'm going to explain why 5 different colors. It's a balancing these 5 elements. So the amulet is also designed in a such a way like that to balance. When you wear that in your naturally, your imbalance and within your body will get balanced. So that's the color. And then there's a mantra inside. Then also astrologically, normally when we look, we are not giving herbs or medicine to it. We are relating more with advice or how the psychological level, you know, normally astrological works in that way. So like more like counseling type, you know, oh, yeah, you are under such and such period and you have to do this remedy, these prayers to resolve. The Indian astrologer also prescribe upaya, they call it. That means like antidote. They're like wearing certain gemstones, and certain mantras. So we also recommend certain, this particularly degenerative period, I recommend like Guru Rinpoche prayers and the Tara prayers and all these, the prayers, it will be powerful to eradicate this situation right now. Then that's from the remedy and the antidotes and the meditations, yoga, that might be helpful. Then also, as the hot water is very important. Then also I may add extra on that is spices, particularly chili. Chili do have some potentials to kill viruses. So the chili, and as a saying in Tibet, when you get a flu like that, the older people said, don't worry, just eat a very hot chili with the tsampa, that's tomorrow you'll be fine. So there are some remedy like, and people used to do that. And then the science behind that, at that time people are not aware. Now, I saw some journal and articles that chili do have very good power to kill and eradicate the viruses and potential. So the chili I may add. Then spices, of course, all the spices like saffron and cardamom and clove, all these have. And then on top of that, when it attacking to the lung, it might be helpful like grape juice. That's one Tibetan medicine use grape as to heal lung-related problems. So that might be helpful. Now, I'm going to go to another point. Like now, this is everybody is asking when the disease will end. So in that, I'm going to I done a research with what the Indian astrologers are saying, what the Tibetan astrology, like my predictions and on this topic. And I did base my prediction on Kala Chakra divination and Yangchar divination. So there are two calculate I base on. So my predictions, when this disease will end, this is $1 million question people always asking me, Jamba, when is it going to end? So my prediction will be, particularly in the United States, maybe at the end of May and mid-June. It's not totally it's going to be end, but we are almost getting back to normal, going back to school, maybe going back to work, and everybody started getting more better. That's an Indian astrologer predicted in India that it will get better mid-April, pretty soon now, because the really interesting is, again, India is starting summer, and the summer means heat. And as I lay down all these elements, that the disease, that the viruses doesn't survive much in the heat, it get inactive. So then slowly it diminishes and totally eradicates from your system. So the heat in India, like April, is really starting getting hot, and May is very hot. So the Indian astrologers are predicting there's all the very renowned and important astrologer. I'm not going to recite their name, but they're all well-known and renowned scholar. And they predicted that in middle of April, and it's starting getting better. At the end of May, it's all, there's no problem. But they have some doubt, according to astrological calculations, saying the disease might bring foreigners. So Indian astrologers are requesting to Prime Minister Modi, you should shut down the Indian airport till 30th June. So after that, there will be no problem. So that's what they're requesting. So, and then there is one Indian astrologer also predicted, a couple of actually, and in a world, it totally get better in September. I think that prediction is pretty reasonable. That like in America, our summer really is something like in August or September. So maybe we could lingering, but my prediction is like May, June, end of May, mid-June, everything get back now, but maybe they have some people still affected. So that's, but around September, it should all get totally better. And so that's the prediction. And prediction could be accurate, prediction maybe not accurate. That's not important. So this, why I done this is more to give some hope, to the people. And also now this wind element is another important role playing. That is highly related with the psychological and mind. So we can use this, lockdown and period as a positive way to be more with the family, as an opportunity to have a cup of nice tea, nice meal. And sometimes when we don't have time to ask questions. Maybe this is an opportunity to ask questions to and make a meeting with the families. What's going on? You know, and normally the kids are stuck with their computer or laptop or iPhone or whatever. Then so there's no connection much. So maybe this is a good opportunity to do that. Plus, and also it may be good to do some connecting with the spiritual and higher powers, to do some mantras, some meditation, some yoga, because we have to do something. We cannot be like a zombie staying on a couch and watching TV, you know. So that's another way. This we say that, saying that always there's a bad news, and always bad news bring a good news. When it came in Tokcha, the cause is bad, but it could bring a positive. That's we have more opportunity. You can spend time with your family, friends, and at least have a nice meal. And most of the people say, I don't have a time to cook, cooking. So now is a good time. You can cook your own meal. And so there are a lot of things to make them oneself active. And so I think I cover up pretty well here with the timing, outbreak, and so the both sides of Indian and Western, Indian and Tibetan astrological predictions. So that's, I'm going to leave here. So hopefully this might help today, showing some light, when it roughly, it might end up as according to my predictions, end of May by mid-June. So that's people can get back to normal. And I hope that this prediction and this, will true, because I'm not a clairvoyant, I'm not a psychic, but I believe and I do calculate on numbers, and the number normally never lies. In my 30 years experience on this job, always numbers is true. Numbers is more like a science, and mathematics is a calculation. So I base my presentations on the numbers element, how it's playing roles, how it's lining up, when the disease happened, when they declare there, people started getting more interest and putting initiative how to eradicate. So I put these two important days plus remedies from wearing amulet, reciting mantra, and so on and so forth. And so now I'm going to end up here. And thank you for the opportunity. And thank you for whoever, people listening all over the world. And I hope this might benefit more in a mental and a psychological way to just cease, because right now a lot of people get really worried. They have no income, and then they cannot go out. They cannot do what normally they used to do. Now I see this there's certain positive energy will come soon by my prediction, accordingly, May by till end of mid-June. So thank you.
Thank you. I am actually not going to spend a lot of time. Thank you, Jampa. That was really fun. Very interesting. I'm not going to spend too much time introducing our next speaker, who is Dr. Nida Chidang Sang. He is, I believe, Dr. Nida, you are in Italy, and we have kept him up very late tonight. So we are very fortunate to have him with us, and thank you for sitting with us, and we should have put him first. So I'm going to let him talk about himself, introduce himself. I'm going to also let you go ahead and just get started. This topic, he's going to discuss his firsthand experience with treating COVID-19 and the spiritual perspectives that go along with that. So I'm going to turn that over to you, Dr. Nida.
Hi, everyone. Sorry, here is quite late. I'm kind of sleepy and tired. And so, can you hear me? Hello?
Yes, we can.
Okay, you can hear me. Sorry. Yeah. I thought I lost the connection. I just want to share some my experiences treating few patients. Of course, I didn't see them physically, but talking online. And so, I think last about 2 weeks, 2 or 3 weeks. So I'm contacting with about 10 patients. And so it is interesting. And to my patients, they are doing not so well, especially first 2 weeks. But now they are doing quite well. And as everybody knows, after China, Italy was hit by very badly, and then especially North Italy. And So the main problem, the Italy is now is the, how do you say, the highest death number. And of course, there are lots of articles, about research on these things. And yeah, the main issue is here in Italy. Actually, Italy is one of the first, how do you say, most elderly people's country. So there are many, many old people living here. Actually, it's a country of longevity. And unfortunately, also many Italians, they are living with, their family members. And so the young people are living with their parents, and then very often also they have a very close contact with their great parents. And therefore, the Italian style is like big families, connections and living together. And that's why there are many, many families, getting infected, And unfortunately, yeah, then especially in the Lombardia area, the hospitals are overwhelmed and there was no space anymore. So most of patients are told just to stay at home, and to have home treatment. And then of course they are organizing the nurses to visiting their home and to just check their oxygen level and ACG, and also especially measuring the temperature. And most of the patients are told if their temperature is not more than 38, and then they could stay at home. And then of course also they're measuring the oxygen level. And so on. So that's why, yeah, I was contacted by a few patients. And yeah, most of patients, like about 7 to 8 patients, they are doing quite well and they have mild symptom, fortunately. And then the problem is they are facing difficulties, the home isolation, and then the family members are taking care of them, and then they are living apartments, and then they are kind of stuck in one room, and then the family try to free one like kind of bathroom for them. It's like the home arrangement is becoming very complicated. And then also the patient who are already hospitalized, and many of them, like they are suffering, what do you say, psychologically. And like one Italian doctor was complaining, like, he's saying for them, the emergency doctors, and mostly they treat their like physical issues. Many people are having difficulties of breathe, and they start to use the oxygen and ventilators and so on. But then most of patients get shocked because once they go to a hospital, hospital are already like overwhelmed by patient, and then they are using these army tents, and then they bring the patient to the tent and they get shocked. They said, how is it possible? It's a tent hospital, and how I can get cured from here there. So that's why this doctor was really saying, and one emergency doctor was saying, he said, unfortunately, he's not a psychologist, and that's why he doesn't have time to explain to patient, and this is a temporary place, and it will be fine, and this and that. Instead of doing the physical things, they had to do that, like psychological talks. And so that's why this doctor was really suggesting if more like psychologists can, step in there in the hospital, and somehow the job between doctors can be divided. There are a group of psychologists or psychiatrists, and they try to support the patient. They need really like a psychological support, and then the emergency doctors, and they try to to resolve the physical issues. So I think that's a very good point, because everybody's scared, and especially the patient are in panic, and once they see they are kind of treated in the tent and like an army hospital, and this they really psychologically can't cope it. And that's why I think that Italian doctor was really really correct. We need to treat the physical part, the virus, and also we need to take care of patient mental part. So that's why mostly when I talk with my patients, so yeah, I talk with them by Facebook or WhatsApp, and sometimes I turn on the video and I try to calm them down, and yeah, to teach them some very simple meditation. And the most effective one is breathing exercises. We have this 9 purification breathing, Longro Gotu. It's a kind of very simple breathing exercises, because many people, I think, most of the patients, they read about the symptoms, and then they know that number 1 symptom is fever, number 2 is cough, and coughing and fever, and combines together, and then the third one is the difficulty of breathe. And we also know that difficulty to breathe, it's a symptom of panic attack, and so that's why there are lots of psychological issues. And I don't think we should just treat it, as a physical, really like a physical. Of course, there's a physical issue. The lung is getting affected, and then difficult to breathe, and so on. But then people, when the patient are not calm and they are in panic, and it's much worse, And even normal, like physically fine patient, if they get panic attack, and one of the symptoms is they feel like they can't breathe, And so that's why it's a very, very similar symptom. And that's why it's really, really important to just to have a very good psychological talk with them. So I'm just also generally talking to people. I'm saying, don't guess your symptoms. Don't get scared. Don't panic. And many people, they just call me. They say, oh, I think I have a fever. Oh, I start to cough. Oh, my, son is coughing. My husband is this and that. And then maybe they have fever and this. I just tell them, don't panic, and also don't guess about their symptoms, because you don't need to guess the symptoms if somebody is really sick. It's important if family members, they think somebody is sick, it's first thing is very important to isolate them and not infecting other family members. And then beside that, if they are really sick, the symptom will manifest. The cough is a really, really strong cough, really, really constant coughing, and getting much worse in the night. And that's why many patients, they have difficulty to sleep, and so they are having nightmares. And most of patients, it's something very interesting here. What I would like to say is, according to Soarik Power, Tibetan medicine says this, one of the main of the symptom is the Rim disease, or Nyanrim disease. And then the Nyanrim disease is caused by the spirits, or the female spirits, mamos, especially, mamos, female spirits. So I'm just telling, for some people, like female spirits are kind of like getting angry and nervous, and they are attacking us. And so somehow the virus is like a biological weapon, So there are many arguments talking, is it a human-made virus or this and that, biological weapon. According to Tibetan medicine, we can say it's a biological weapon by mamos or aliens, but they are female aliens. And so this is very clear. And also in the Yutol's prophecy, he called this kind of disease called Duruka, This is the future, like pandemic disease is called the Turuka, and Turuka is caused by Mamos, Nagas, and Za, you know. So when we talk about astrology, and most of the astrological, how do you say, the most astrological influences are connected with Rahula. So I think that makes sense. And then in any way, so why I really think it it has a connection with these spirits, invisible spirits, because people are having very strange dreams, and they have very strange dreams, and they have very strange feelings and thoughts. And then suddenly they get these panic attacks, and sometimes the symptoms disappears, you know. And some of my patients says, oh, today I feel much better. And then in the night they get panic attack, and next day they feel much worse. And so that's why in Tibetan we call donji kappa. Donji kappa is kind of the hidden symptoms, you know, the hidden symptoms. And sometimes it disappears, sometimes it comes. It's so even when I ask their pulse, I couldn't check their pulse personally, but when I ask their pulse, they said their heart sometimes beats very fast and sometimes stops and so on. So that's we call it a dondol, you know. It means interrupted pulse and caused by this kind of spirits and so on. And so that's why I suggest my patient to do the mantras. And because of the main spirit behind of this coronavirus is Mamo, you know, or most of the epidemic disease are caused by Mamos and Menmos, the female spirits. So that's why I tell people to recite this mantra, Bam Hari Nisa. So Bam Hari Nisa, 5 syllables. Those are the 5 syllables of 5 dakinis. And then it's very important to do breathing exercises and also some kind of simple meditation, because then they can help themselves to come down. You know, I think that part is very, very important. And so yeah, the big challenge is every day when I talk to them, and you know, some of them, they says in the morning says they feel much better, and then evening they feel worse, and some are exactly opposite. In the evening they're feeling okay, and in the morning they are feeling worse. But it seems the most of patients, they suffer more in the night, you know, in the night, and also they feel very tired and shivering, and you know, body aching everywhere. And so because of the coffee is very strong in the night, and therefore they can't sleep well. And we can understand, you know, if somebody can't sleep well and then the next day the immune system is crushed, and then, you know, they are feeling much worse. And also another main symptom is the weakness, you know, they feel really, really weak. And even, you know, we healthy people, if we don't sleep well in the night, next day we feel kind of tired and weak and so on. I think that's kind of normal. So that's why I tell a patient to take more like sleeping remedies. And here the problem is, you know, I have some Tibetan medicines. You know, I produce Tibetan medicines in Italy by myself. And also there are some good medicines produced by in Switzerland, the Padma company, and this. But now the problem is, you know, people can't order those medicines, so we can post these things and you know, through the post offices. That's why it's becoming kind of giving the medicine is, you know, having lots of obstacles. So that's why what I really suggest them is to make some home remedies if people are having difficulties for sleep. And I told them to take some veggie soup or garlic or onion soup. Actually, it's a very good for a sleeping remedy. And if that just garlic or onion soup is not helping, so I told them to add more nutmegs, you know. But nutmeg you cannot add too much. It can be toxic. So 2 to 3 pinches of nutmeg in the soup, or also in the warm milk. And sometimes clove helps. And then also I teach them some very basic, simple like massage, warm oil massage, self massage. And many people, they are experiencing this shivering. And actually in the Tibetan medicine, we call it Rim. Rim is the infectious disease, and the Mamimba means unripe tsawa or unripe fever. So that's the part of the shivering part. And for some people, it's really difficult to get rid of that. Of course, before one of the Tibetan doctor mentioned about drinking lots of hot water. Patients are drinking lots of hot water and warm soup and this and that, and they really have this very, very strong shivering. And they, some of them, they are saying like they feel like their bones are iced, like frozen. And of course, then I tried to suggest them to take like a ginger tea, to boil the ginger, to take a very, very strong ginger tea. And then, it's normally we give manushitang, like inula 4 decoction. It's a good medicine, but unfortunately I can't give this, inula 4 manushitang. I don't, they can't get it. So that's why I'm just suggesting to have like ginger tea and cinnamon tea and so on. And it's not that working very fast. That's what I can say. It's not working that fast. And some people, they feel a little bit better, and then they feel worse, and up and down. And so that's why what I really feel and what I can suggest is the spiritual part, doing the mantras and doing the rituals. Of course, by myself, I do the rituals and I do the mantras for my patient, So like last almost 2 weeks, when I come back to Italy, and I start to do 2 to 4 hours of mantra recitation. We have the typical medicine Buddha's protector, medicine Mahakala Shanglon, and then his consort and Nojin Dundruma. So according to the Yuto's prophecy and according to Tibetan medicine, so we should do more rituals with mamos, So that's why I'm doing these rituals. And in a very interesting way, each time I do rituals and write down their names, I'm doing the prayers and these things. And 1 or 2 patients, they said, one or 2 patients, they said, oh, your rituals and your prayers are working better than your soup suggestions or taking herbs and spices and so on. So I'm sure both ways are helping. And but with this my personal experiences, it's really, really important that we give spiritual support for the patient. And I also want to say, of course, in the Western medical science is talking about vaccination and effective drugs and all these things. I don't against these things, but I think also it's an important moment that the Western MDs, medical doctors, they should embrace the herbal medicines. For example, in China, and they used a lot of TCM herbs, Chinese herbal medicines. And some of them, they are very effective. Of course, it seems they used these herbal medicines more for mild, patient with mild symptoms. And it seems it's really helped, it seems really helped. And also some my patients, some of them, they had, they got some medicines and they said it's really, when you take medicines, it's helping, And so that's why I think it's a very important time that Western doctors to accept the herbal medicines. Like, Chinese government send few doctors to Italy, and these doctors are coming here. Of course, they bring like a facial mask and ventilators, and then lots of like herbal medicines, in Italy, it's a herbal medicine is a kind of illegal, but now the Chinese doctors, they bring the Chinese herbs and they kind of have to make it legal because Chinese doctors are saying, okay, these medicines are helping. So that's why I think it is a important thing, and hopefully the medical doctors, they can learn some lessons also using the herbal medicines or using the meditations and yoga and spiritual healing, how it's how much is helping the patient and these things. I think that's why like in China, it seems there's a big change. Especially the many like Western medical doctors, they are saying, oh, and some patients are treated by the herbal medicines and they have much better result, and instead of using like, how do you say, testing like chemical drugs to saying, oh, try this one, trying that one, of course, most of chemical drugs, they have also heavy side effects. And that's why herbs, if you, and patients are staying just at home and home isolation, and if they have a fever and they take paracetamol to reduce the fever a little bit, and beside that and coughing and this, instead of doctors are saying, oh, we don't have anything, just wait. I think it's very important to help them with herbal medicines, and also to guide them with lifestyle and diet, and these things are very important. And in my experience is in the lifestyle, the most important thing for the patient, there are two things. One is good sleep. I'd really try to help my patients to make sure that they get enough sleep. Enough sleep, I mean like from 7 to 9 hours of sleep. And that's very, very important because each patient, if they can sleep very well after really good sleep and after good sleep, they all are saying like they are feeling much better, and so that's why this is very the sleep is very important. And then the second one is most of patients, they are kind of scared and they think they cannot move, and if they move, they start to cough, and then everything gets worse, and then they don't move, and actually that makes worse. And so that's why the second lifestyle is the exercises, yoga. So I just teach them Tibetan healing yoga, Nejang. Ne means the location. Jang means like purifying. Very simple exercises. And so many patients, they are having the pains in their joints. So I just told them, how to do the joint exercises and the neck exercises. And even it's kind of like even like simple and very easy exercises. It's very important the patient do these things, because when they don't move and they think if the movement is making them worse, coughing and a fever, I think that's more fear. And if you help them to move them and exercise more, and then after 2 or 3 days, they can find they can they can see the better results. So that's why in the lifestyle, I suggest these two things. One, it's important to get enough sleep, and two is to do exercises. And in China, the many Chinese patients, they are doing like Tai Chi or Wushu, the Chinese like martial art and exercises and these things. I saw one report also, like this martial arts, how helped many patients. And also in my own experiences, to just telling them to do these physical exercises are really, really important. I call it mini exercises. Some patients, they're saying they can't move. I said, just move your head, just move your shoulder, and very these basic things. And yeah, these two things are very important. And then I know like globally, they are organizing many prayers and rituals. And then, of course, every different spiritual groups, they have their own practices and these things. And my experiences, it's really to do prayers or mantras, and especially the rituals, rituals of mamo for pacifying the mamos are very, very important. And of course, also it's important to know that mamos are not the bad spirits and they are attacking us. If you read the ancient text, it says we disturb them first, So mining, destroying the nature, cutting the tree, and sucking the petrol and the gas, and how much we destroy our environment, and how much we destroy the wildlife, and how many animals we kill them as a food, So because of the human wrong behaviors, and we disturb animals' life, we disturb nature, and we disturb everybody. And so that's why the spirits, the invisible mamos are upset. And then somehow, and the interesting thing is like Mamo, Nurjin Tundruma, and also Benden Lamo, like they have a sack, is called the sack of sicknesses, So we call it remedies chalwa. Actually, this kind of the sack, the sickness is infectious disease. So somehow they are kind of controlling this kind of disease. And this Nurjinma's mantra is called Om Banza Ranna Banda. Duma Tingcho Tingzanza Banda. Banda means to close it, to close it, to tight it. And so it means we are really requesting or asking the mamos to close their bag of the viruses or bacteria, whatever, they are biological weapons. So yeah, that's my experience. And good news is all those patients that I'm treating and I try to help them, nobody's dead. And everybody's having a good result. And also after recovery, and people really, the patient, they need lots of rest, they really need to recover. And there is in the one of the Pamasambhavas, Dharma, he says, we need a medicine for treating physical body, and we need the Dharma for nourishing the mind. So we need good food and good herbal medicine for nourishing the body. And we really need a good spiritual practice, meditation, mantra, yoga, whatever, to nourish the mind. So to combine these two things are very important. So that's my suggestion. And another thing is, if somebody is helping, if you guys, anyone have like a patient at home, please be careful. I know some patients, they are saying, oh, it's my son, oh, it's my mom. I cannot say, okay, I don't enter in your room and these things, Of course, feeling, it's a feeling. Of course, our love is love. It's very important we protect ourselves, Even it's your mom, what is the main wish of your mom is, your mom doesn't want to infect you. That's her main wish, right? And I know these people are saying, oh, I'm sick, I'm okay, even I'm dying, I'm okay, but I don't want to harm my family members, my friends. So that's their main wish. That's why I think it's really, really, really important, to try our best to protect ourselves. And of course, there are many good, good advices about how to protect ourselves and how to keep, isolated the patient at home, these things. I think we really need a good, good education on these things, Somebody is sick in your home. So it's a new job for us, right? And it's for us. And that's why we really need to have a better education, and we need to be ready for these things. And yeah, that's it.
Thank you, Dr. Nita. I know that there was a lot of questions, especially for Dr. Nita. I believe a lot of people want your home remedies as well as your mantras. We are vastly over time right now, so I'm just going to ask for our audience. I'm going to ask him to write them up and get them to us, and then that way we can send them out to you all, because there were several questions on that. I think we're just going to end up having to send everybody the questions. So our audience, make sure that you are filling out that form for questions. If you put it up on Facebook, we may or may not be able to get it. Yanzum's working very hard to get those to me. But just,
Okay, if they want to write to me on Facebook, my Nida Jenaksang is full. I can't add any more friends, but I have a page. It's called Dr. Nida Jenaksang, so they can write me on that page.
okay. And we
Yeah,
can
yeah.
also, like I said, we'll collect the information and send it out as well. I
Is
think,
it okay to answer like 2 questions now, or we don't have time?
sure. I think everybody's okay. They were interested in
Okay, then let pick up 3 questions.
3 questions. Okay. One person has asked if you could repeat the mantras that you had said.
Bam Hari Nisa. Bam 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 HA Ha REE Bam Hari Nisa NISA Bam Hari Nisa.
Okay. Did you guys get that? When we'll add that. The second one is obviously the home remedies, but besides, and this is open for anyone, besides hot water, hot broth, hot tea, lemon, ginger, honey, what Tibetan herbal pills or powders would you recommend or prescribe?
One is very good one, and hopefully, yeah, people can find it. It's called the Norbu Duntang, the decoction of 7 jewels. Decoction of 7 jewels, Norbu Duntang. Actually, this one is very good one. Yeah.
Okay. So we're
It's a very good decoction. Yeah.
excellent. And of course, they can go see their local Tibetan
Yeah,
doctor.
exactly.
To get that
If they don't find that one, you know, this is a combination of two herbal formulas. Probably many people know this Triphala, you know, Ayurvedic remedy, Triphala. Actually, Triphala itself, you know, there are 3 fruits, and also Triphala it's a very good, yeah. Yeah, when I told my patient, some of them, they couldn't find the Manushi, you know, the 7 altogether. They took these 3 Triphala. Actually, it helped a lot, yeah.
This is also open for
I
everyone.
just wanted to mention also that Dr. Khenrab Gyamtso's slides have a lot of those formulas all listed on there, and those will all be available for those who want to access them. And so ideally, people would be having a Tibetan doctor like Dr. Nida Chinnatsang in Italy, or like Dr. Khenrab Gyamtso in Toronto, or these various resources for being able to know how to use them, how to use them safely. But we can also make those available to them as well.
Thank you, Tani.
Thank you.
This question's open, and again, I'm just picking out a few of these. This is our last question. This is open for all the doctors, and I think a lot of people could chime in on this. They've heard a rumor that people have had COVID virus already. Can they get it again, or can they not get it again? They've heard that some people have been getting it a second time.
I don't think they can get it anymore, because the problem is, okay, I'm just saying according to the Chinese research, and also it happened in Japan, somebody got it, and then and they are cured, and then they re-got it, but I think that was the mistake with the testing, you know. Yeah.
There's also not necessarily conclusive evidence about how much people's bodies have created an antibody response to it, and that there's some aspects that the virus can have subtypes that mutate. So I think this is still an area that we're really looking at as we develop herd immunity, as we develop the capacity to create vaccines as well. And so part of that is helping, as all these remedies have been discussed, really supporting the immune system so that the body can naturally create that response in and of itself, so that it does be able to fight the infection through all this great dietary behavioral advice, the great cleansing breaths, all these things.
Thank you.
Clarification, this for Dr. Nida and Dr. Tidwell, actually any of the doctors? I keep getting muted. Okay, I'm not muted. The formula that you guys had mentioned, Norbu, is that for prevention or treatment or both?
Both. I would say both, yeah. Normally, okay, I would say both in an easy way, because this formula is a quite safe one, you know. If somebody takes for prevention, I suggest just take once a day, you know. You can drink in the morning. And when they take as a medicine, normally I'm suggesting them to take 3 times a day.
아니 탕데라 노부 딘다 요레 조선당 승에 요레 만드시 탕 요레 나 다름살라 멘지칸 그 유자부 수네 잠구요와 추탕 승에 제 요레 티백는 동에 요레 이게 참말로 아니 꾸네 아니 동 아니 주부 아니 조지 원하자 투바이나 차베 강인디 조부야 민지니 말아니 자야의 펜도 텐데 용구요레 어디서 네 나가 계시샤 네 차원이야 당고 세니자의 핑기요 레슈아인.
So there's various decoctions such as the Norbutun Tang, the Jewel 7 Tang, the Manu Shi Tang, Manu 4 Tang, and also the Drepu Sum Tang, which is the Tibetan way that we describe Triphala decoctions as well. And there's a specific formula that Mentsekhang India has created called Trutang. And so all of these will be particularly what both Dr. Khenrab Gyamtso and Dr. Nida Chinatang had talked about in the unripened fever stage, when the initial fever is coming up, when the initial perspiration is coming up, to really take that heat and expel it, right? So it's fantastic for that early stage, both preventative, but also in the mild ramping up of the disease.
Yeah, I think that's many people, they really need help for that, you know, for ripening this unripe fever, because one patient, it took more than 3 weeks. She was constantly shivering more than 3 weeks. It's really, really horrible, you know.
Okay, unfortunately, we're literally 30 minutes over. So thank you guys, thank you audience for
Thank
sticking in with
you.
us. Don't everybody leave except for Dr. Nida. I am going to turn over to Dr. Kalzong for a minute. She wanted to talk. She is the founder of Kundi Institute, and with the other partners, which we'll mention again at the end, was instrumental in putting this together and bringing all the doctors together. So before we wrap it up, she just wanted a few minutes to say some things.
Okay.
Youngdun?
Hi, yes. So can you hear me? Yeah? Okay, good. So thank you very much for every single doctors and our ITs and our monitor to put these things together. Especially, I apologize for Dr. Nida, and I put him the last who needs to go to sleep the most, earliest one. So I sincerely apologize for that, but I put this because of the topic, so it flows this way, because I put you as a first-hand practice in this way. So hopefully you can sleep well tonight. So it's my great pleasure to put these things together, because I have found this, that's what President Trump calls, right? Invisible enemy in this world. So now we figured out what is the invisible animal is the Mamu spirit. It's disturbing our life, our mind, our body, our relationships, our family, everything. However, there's so much thing that Tibetan medicine can offer, which is being neglected, and nobody sees this. And I want to take this great opportunity to thank all the speakers to put this great presentation. You covered almost everything from different perspectives, although this is just like appetizer of the Tibetan medicine to hope for these conditions. There's so much thing that Tibetan medicine can offer, because Tibetan medicine is not only as the integrative medicine, also as a holistic medicine, as you probably see now. It's not only dealing with the physical body, but also the mental health, spiritual health, everything plays a part to make you as the person for your own health. So we organize this one to benefit all people who are suffering from this invisible enemy, who does not need the passport, who does not need a visa, doesn't cost anything to travel globally and internationally. So we still have a method to cope with it. And we, just like Dr. Nida said, we also need to work together with the Western physicians, CDCs, public health, a lot of different departments. We can work together. We want to offer you this great treasure to work to help people. And our main goal is to show you there's a holistic and integrated method to work with this, not only to follow up we follow all the CDC guidance. We do all things. In addition to this, we can add into this holistic medicine method. And our goal is to reduce hospitalizations and to make sure that patients do not need to go to hospitals. You see, Dr. Nida already mentioned what happens in the hospitals, and they don't have a supplies, but also there's the highest chance to get infected. And to provide self-care, self-healing with all different methods through the mind, body, from your mantras, from your cooking, from doing all sort of things. So we have 2 more talks coming up for next 2 Thursdays, and the time will be announced later because we're still working with some other speakers. So hopefully I don't put them in too late like this. So again, sincerely, I appreciate every single speakers and everyone put this work together, especially Tani, and did a great work. She started from beginning with me, from scratching, brainstorming everything with me, including Robin, who is my advisor as well. So everybody did this through the volunteer position, and thank you very much for your effort. Thank you. Tojichi.
Tibetishe.
Tojichi. 야, 심장나고 괜히 들라.
Semjanango, Semjanango.